Hi, and welcome back to Unmasking the Trans Movement with Jon Uhler. I'm your host, Brad Wilder. On our last episode, Jon spoke with Dr. Ann Gillies about several topics, relating mostly to gender dysphoria. Now, where we left off was at the medicalization of vulnerable kids. And there's a lot happening with our kids today, from our schools to doctors to medical professionals, mental health professionals. It's all being pushed on our kids. And that's exactly why Unmasking the Trans Movement exists. We're here to break it down again today. I'd like you to welcome our leader, Mr. Jon Uhler. Jon, great to have you on the show today.
Brad, as always, thank you. We couldn't do this without you. And Brad, we're both very excited to have back with us Dr. Ann Gillies from Canada. So this is truly an international effort now. And Ann is a Ph.D. She is a scholar. She is an author. Ann, welcome. We're going to pick up where we left off because we are talking about, as we set the stage for, in referencing the rapid onset gender dysphoria, or really social contagion that's taken the world by storm, certainly families, certainly parents by storm. You have addressed that. You have written some books. As a matter of fact, would you share with the audience your website and how they can get a hold of you? And then let's talk about how this entire trans deception, the trans movement, those that are pushing this grand scheme, this scam, this grand deception, are setting kids up to be exploited once they're allowed onto the moving sidewalk of the trans movement. They're going to be sterilized, then amputated, and there has recently been a whistleblower. So tell people about your resources, about your website, and then let's pick it up where we left off last time about the concerns about the medicalization and the whistleblower.
Wonderful. Thanks, Jon. Absolutely. So you can reach me at www.restoringthemosaic.ca, and you can reach me through that site. You can also sign up for my newsletter, which I suggest you do. Also, there are videos that you can watch, and I have a lot of information on that site that might help parents and grandparents to understand some of the things that have been going on in recent years. So yeah, we were talking about gender dysphoria, rapid onset gender dysphoria, and the young girls in particular. So some 85% of them are young girls, and who are deciding suddenly that they are born in the wrong body. And all of the terminology that goes with that is part of the corruption of the language. And we need to take all that back. But the neat thing is, and it's been happening a little more in the last 2 years. For instance, there was a whistleblower from Tavistock, that actually Tavistock Clinic, gender clinic in the UK, Kira Bell, who had been through their program and decided to talk about it, and nailed them for pushing her through there and without her understanding the ramifications. Well, what's happened in Tavistock just this past summer, so summer of 2022, Tavistock Gender Clinic actually has shut its doors because I think over the course of the last 2 years, there's been 35 psychologists, psychiatrists, psychotherapists that have walked out. And so there is a lot of stuff that's been happening behind the scenes that is coming to light. But what happened last week on Friday, I shot you an email because I had gotten an email about a whistleblower. And her name, I'm just going to make sure I have it right, is Jamie Reed. Now, Jamie Reed worked at the Washington University Transgender Center at St. Louis Children's Hospital. I had to read it. I wouldn't mess that one up for sure. But she'd been working there for a few years, and she was a prime candidate to work there. She calls herself queer. She's married to a trans man. I'm not even going to go into all of the dynamics of that. But what this woman has done is literally spoken truth in the marketplace. And kudos to her. It meant she lost her job. And I'm going to probably just actually read some of the excerpts from her article. It says, first of all, I thought I was saving trans kids. Now I'm blowing the whistle. She's been there, done that. She saw what was going on. And what she recognized was that they're hurting these kids, and that so few of these children or their parents have any idea really of what they're getting into. And so I'm going to talk a little bit. I'll try not to be so graphic here because her letter is quite graphic and it's disturbing, but I'll just give the highlights. In 2020, she says a 17-year-old biological female patient was on testosterone, and she was in the clinic. She was having really bad issues. Testosterone in females actually weakens the vaginal muscles. And what happens then is, for this girl, her vaginal canal ripped open. I know that's still too graphic, but it's not as graphic as what Jamie wrote. She had to have surgery. And, these children, nobody talks about any of the things that's really happening to these children.
They've become a product of the medical world, don't they?
Oh, lifelong, Brad, lifelong, because they start them on puberty blockers, stop their puberty, mess with their body, mess with the mind and brain, because nothing is developing as it should, go to hormones, right? Put on hormones, cross-sex hormones that make them look or act like the opposite sex, and
right.
then
and just so that the viewers can really absorb this, we're talking the body's endocrine system.
Yeah.
So things like compressed and broken ribs, we've got punctured and collapsed lungs with the surgeries going on, back pain, compression of the spine, damaged breast tissue. Obviously, there's damaged blood vessels and clots, inflamed ribs, and even heart attacks. People are actually possibly going to die because of these procedures. So you mentioned earlier about the institute that closed down. You said 47 or 37 doctors had left there. Was that because they recognized what was going on and the harm they were doing, or was it something else?
No, they recognized what they were upset about is that these children were being pushed through so quickly that they weren't given adequate mental health care. And you see, with mental health, there's always been a prescribed progression in how to treat particular diagnoses, right? And I have come from this perspective that most diagnoses actually are trauma-based. So if you treat the trauma, you will help eradicate the diagnoses. But of course, with these children, and I said in the last show that a high percentage of them have acute mental illness issues, and then 30%, up to 30% are autistic. But we're not treating those. So these professionals walked out because they saw that what they were doing was jeopardizing the child's immediate mental health as well as their long-term physical and mental health. So I think we'll see more and more of professionals walk out.
That's exactly right. And that we're going to be seeing more and more, at least those that have integrity. That is such a crucial point that you've just brought up. Continue with Tavistock, because again, people need to understand under socialized medicine, the UK had one primary location. So those therapists, and Dr. David Bell, I believe it is, who was the head, he was the director of this, he blew the whistle himself. He said, enough is enough. And the powers of this transgender juggernaut descended upon him. And he was hearing it from clinicians that, wait a second, we're trying to really ascertain what is going on with these kids, but the pressure was, do not question, do not ask, just fast track these kids. Take at face value what a child says, a child that is coming to a clinic, why? Has mental health issues. So we're taking at face value a minor's own diagnosis, and then those that have implanted in this child's mind unfortunately a delusion which says you're born in the wrong body. So these kids, and Anne, you just said it, you are a trauma professional, I'm a trauma professional. These kids are troubled, probably very many of them either on the autism spectrum or have past history of sexual abuse. Absolutely. And they're easily manipulated. And so they then are hearing about this issue of, well, maybe I'm born in the wrong body. I have distress. They're being offered a magic fix, which, hey, if you go through these, take these pills and just have a couple of these surgeries, poof, everything will be fine. You've indicated that is not the case. And then this whistleblower here in the States said enough.
She did say enough. Unfortunately, in the US and Canada, we are not going the way of the UK because UK, Sweden, and Finland have all put the brakes on with transitioning. They do not do transitioning of minors under 16 now. If you're under 16, they'll no longer begin the transitioning process. So they put the brakes on. In Canada, 8, 9, 10. I mean, we're encouraging children to socially transition immediately upon them deciding that they might be born in the wrong body, which is absolutely ludicrous. And so in our countries, there are not very many standing up and speaking out. They're too afraid. They're too worried about their job, their financial security. And I mean, I get that. But there are more important things, honestly, and that is our children. She shares another story. She said one of the saddest cases of detransition. So what that's talking about, and Jamie Reed acknowledges, is that these children then decide, after they've had this medicalized process happening, they decide this isn't right. And so this is what she said. One of the saddest cases of detransitioning was a teenage girl. So many of these patients came from an unstable family. Bang, she got it right on. She's talking about insecure attachment. And then she said uncertain living condition. So, there's trauma, history of drug use. This child was transitioned, put through the process, even though she had all these other things going on. And so she was put on hormones when she was around 16. When she was 18, she went in for a double mastectomy. Remember last week I was talking with the doctors, one particular doctor who does a lot of double mastectomies now tells the young girls, okay, it's time to yeet the teats. Like, come on. How professional is that? And not only how horrid. Anyways, 3 months after this girl had a double mastectomy, she ended up back at her surgeon's office. And Jamie Reed says this, she wanted to go back to her birth name and that her pronouns were now she and her. I mean, she was, back to biological truth. And then she told the nurse, I want my breasts back. I want my breasts back. Can you imagine? And, there's no way of doing this. No way. And so the surgeon's office called Jamie Reed's office because they didn't know what to say to the girl. Okay, you are a medical professional. You have removed this child's, you've amputated, her breasts. And you can't even answer her question now. You're not prepared. Give me a break. Anyway, so, Jamie had to deal with it. And of course, this girl will never be able to breastfeed. She will never, have what normal women have. And it's just crippling these children. And then Jamie outed. Oh, this was so good. This is for you guys in the US, Dr. Rachel Levine, right? Who is that high official in the State Department, Department of Health and Human Services. Anyways, because she said that the clinics, Rachel Levine said, are proceeding carefully. And
But
that
Dr. Levine actually was promoted to an admiral, I believe.
I know.
I don't know if Dr. Levine ever served it. I don't know. But that
No,
shows
I don't
how
know either.
political,
And quite
how
honestly,
political this has become.
oh, political, because Levine is a trans woman, right? So she said that the clinics are actually operating very carefully and that no American children are receiving drugs or hormones for gender dysphoria that shouldn't. You know, here you have someone high up in the government, the federal government, making statements that are false. And so Reed, exposes her because she said, yeah, there's tons of children who should never be on these things. In fact, probably the vast majority, when you think of the small percentage that ever was diagnosed, and they weren't put on any of these drugs. They were able to rectify their biology. They came to the place by the time they were in puberty of saying, you know what, I really am a boy, or I really am a girl, according to their biological makeup. And, so 15 years ago, there were no gender clinics in the US. Now there's 100. And don't even dare to tell me that isn't about money, money, money. And we are mutilating these children. We are ruining their lives for what? So somebody can get rich. And the hospitals are getting rich. The doctors are getting rich in these gender clinics, and the children pay with their lives.
There was a number that was associated with that in terms of income, John. Was it $3 billion or was it $3 trillion a year?
According to Jennifer Billick of the 11th Hour blog, I want to give a plug. If anybody wants to follow the money, nobody's done it better than Jennifer Billick of the 11th Hour blog. And she has apparently run the numbers, and she references it is about $3 trillion, but worldwide, this is a multi-trillion-dollar industry. It is absolutely sick what's happening, because they are manipulating kids that have mental health issues, and instead of getting those kids actual help, they are not encouraging any exploration as to where this issue started. They're just fast-tracking these kids. So they are exploiting, they're taking advantage. This is criminal. This is unethical. Since when in the world of mental health, and you're a professional, I'm a professional, we used to be trained because it was normal that if you're a therapist and somebody comes in, regardless of the age of your client, and it's clear that they are not doing well, that they are in emotional or mental distress, that we begin to explore, how did this happen? When did this come about? But oh no, not any longer. We're supposed to take a child at his or her own word, meaning I don't feel right. And here's one of the concerns, and this will hopefully be very helpful for parents or grandparents or teachers. Here's some of the two of the primary concerns I have, because now legislation, especially in Canada, requires mental health professionals to quote unquote affirm this child. Okay. Well, isn't that interesting? So they are mandating that we do poor therapy. But what I would say is this: the requirements of mandating reporting haven't changed. What does that mean? Suspected abuse. What kind of abuse? There's about 5 different kinds. One of those is sexual. For a child, for a minor, especially middle school, junior high and high school, it is very common. It's one of the key red flag indicators. There are about 9 of them, that if a girl comes in, it can happen with boys as well. But if a girl comes in and sits in front of you and says, I hate being a girl, I wish I was a boy. Okay. Any normally trained therapist, the first thing that really should go through that therapist's mind is, has this child been perped on? Have they been sexually abused? Why? Because the child will typically conclude in their mind, makes sense why they do this, that the reason why this perpetrator is perping against me is, meaning sexually abusing me, is because I'm a girl. If I wasn't a girl, then they wouldn't be perping on me. I wish I was a boy. So that is a key indicator that there is the possibility of sexual abuse going on. You cannot fulfill your responsibility as a mandated reporter if you can't begin to ask questions. The other is this: whatever happened to informed consent? If I can't take a young person, so let's say a teen comes into my office and says, I want to be a boy, let's say a teen girl. It shows all the indicators. We've got depression, we've got anxiety, we've got mood instability. Those are being typically labeled as bipolar. We've got eating disorders. We've got self-injurious behavior. And she comes in and says, I don't want to be a girl anymore. I want to be a boy. Okay. I'd better think in terms of safety and protection. But since when did we ever, when it comes to life-altering decisions, not ensure informed consent? Kids can't make that, but according to the government now, apparently they can. Well, okay, how about we as mental health professionals ensure that there is true informed consent? The doctors aren't doing it anymore because of the financial incentive. So can a child really consent if, for instance, they don't know that top surgery is actually a double mastectomy and what that's going to look like, number one? So does a child know what they're submitting to? And for a boy, do they know what castration looks like or having a false vagina drilled inside of them? Do they know what it's like to try to urinate after that? And do they realize, and here's the grand scam against these boys, that they're never going to have a vagina. They're going to have an open wound that they have to continue to keep open and what they call dilating for the rest of their life. Then they're going to become a consumer of pharmaceuticals, meaning they're going to be on drugs the rest of their life, forking out thousands of dollars per year. And think about all the side effects. And I know, like me, this drives you crazy because you're a fellow trauma professional.
Oh, absolutely crazy. And one thing you didn't mention, which you did mention a lot of things, is the multiple surgeries, because these surgeries don't go as planned. And so these children end up going back and having repairs to the alterations of their body, the intrusive alterations, they have drains put in, there's all kinds of things happening. And because the drugs, the hormones do such an intrusive mess up of their physical body that their body doesn't respond normally anymore to all of these things. So healing from all these surgeries, and the doctors don't want to talk about how many botched surgeries or how many repairs they have to do. So when you were talking about money being made, I have not a question in my mind about the trillions, because for a double mastectomy, I think in the US, it's about $40,000 goes to the doctor, I think. I could be wrong there, but I know it's about $40,000 for one double mastectomy, and these kids are lining up to have it done. This is criminal. It's every doctor that does such a thing should be in jail.
100%.
You know what's come to my attention? Sorry, John. One thing that's come to my attention is, and this plays into the surgery aspect of things, they're actually starting to take away the amount of I want to say carbon, but it's not carbon. It's a global emission now that is caused to do harm on the climate. It's all about climate change, and it's for the better of the climate, but they're actually putting less anesthesia into patients medically now in the United States, which again gives them less, well, they're going to get more pain is what I'm trying to say. Have you heard of that?
I wasn't aware of that, that they reduced the anesthesia, but there's so much pain with all of this anyways. And the children, here's another element that we haven't talked about these young girls. And I did an interview, it's on my website, with a young girl. She was 17, so still a minor, but she had transitioned and then went through detransitioning. But you know why she really wanted to become a boy? Because she was terrified of puberty. She didn't want to go through puberty. She didn't want to have all that pain. Why'd she have to have monthly cycles and all that pain? I mean, this girl came to her senses. Thank God she had good parents that were helpful with her, and she got out of the school for the summer and changed her mind completely. But here we are, teaching children they can avoid all this pain. Just go through all these things, and then have multiple surgeries. And when you're done those surgeries to somehow try and make yourself the opposite sex, then 2 months later you might have to have another one, and 5 years down the road it's just money, and it's the saddest. Yeah, it's sad. I don't want to talk about it anymore. That's how frustrated I get.
Well, that makes
and that's
sense.
what's so compelling about you as a guest. We are so like-minded here. We are all about helping parents, helping good people, helping confused minors understand that the trans movement is a man-made deception. There are no trans kids. There are kids that are confused, kids that are wounded, kids that are have mental health issues that need help. And to suggest to that type of child, or to suggest the parents and manipulate the parents by, you're going to tell them that, well, if they don't allow this, their child is going to commit suicide. That is just downright sick. That's emotional blackmail for these parents. The reality is the increase of suicide dramatically increases, as you've referenced, because I call it buyer's remorse. You've tricked these kids, you've manipulated, lack of full disclosure, therefore they have no informed consent, and they have had their boundaries crossed prior to having all these issues. All that to say, you take a confused, troubled young person, and now you do what to them, and you expect the outcome to be positive? I don't think so, and that's what our concern is about. You are writing about this. You have written about this. You have a new book coming up. Would you talk about your book? And we're going to have you back because we're going to do a review of that, and we're going to continue to have Dr. Ann Gillies back. She's a wealth of knowledge. She's a professional in the field for years, and she is passionate, like we are, to unmask the trans movement.
So the new one that isn't quite in print yet, but it will be hopefully by the end of February, is called Implosion. And so in that book, I'm actually kind of just bringing a bunch of stories, cultural stories that are happening right now, and bringing them into play so that readers, the general public, and Brad, you talk about being a blue collar. So this is a blue collar book to say, look, enough of this. And I'm exposing a lot of things in there regarding some of the activism within the LGBTQ and some of the things that have just led us to this time and place. So yeah, stay tuned.
And thank you for your time, your expertise. And Brad, we're looking forward to having Ann back with us.
Absolutely. Thank you very much to both of you for being here today. Jon, thanks for your time. Dr. Ann, so much knowledge, so much to go yet, and so many different things that we're going to be able to communicate and help moms, dads, grandparents, and even kids along the way. This is Unmasking the Trans Movement with Jon Uhler. I'm your host, Brad Wilder. Thanks for watching. We'll see you next time.